We either stop Ebola now, or we face an entirely unprecedented situation for which we do not have a plan.
It's a fight, because this enemy knows no borders.
In the 30 years I've been working in public health, the only thing like this has been AIDS. And we have to work now so that this is not the world's next AIDS.
It's difficult to see how an overcrowded hospital would cope in the event that an isolation area was required.
This is a continental and a global threat.
Sometimes you pray for them. Just hope that something miraculous happens.
A deadly disease, a killer virus. Little is known about Ebola, and we're facing the worst outbreak the world has ever seen. In just 10 months, more people have died than during all other previous outbreaks combined. A bloody record for a virus we've known about for less than 40 years. What was once an obscure illness is now a household name. People worldwide demanding answers to crucial questions. What is Ebola? Where did this outbreak come from? How could this have happened? And what happens now? No one seems to know what's coming next, and the world's top doctors are not playing down the threat.
Ebola virus disease in West Africa is the most severe, acute health emergency seen in modern times. Fear of infection has spread around the world much faster than the virus.
Ebola is not an easy disease to contract, but when you get it, the clock is ticking from the moment it enters the body. The virus is carried in bodily fluids, in the blood, saliva, mucus, sweat, and the tears of the infected, along with semen, vomit, urine, and feces. It enters the body through direct cuts on the skin and through the eyes, nose, mouth, throat, or reproductive organs. People can also become infected through contact with contaminated animals. The virus can survive several hours in a dried state on everyday surfaces like doorknobs and countertops. If the fluid remains wet and at room temperature, it can survive for days outside the body. But when is someone with Ebola actually contagious? The short answer, from the day they start to show symptoms, which can take from 2 to 21 days to kick in. In other words, a person could travel and interact with others for days or weeks without passing on the virus. The average incubation period is 8 to 10 days. Early symptoms of the disease: fever, weakness, muscle pain, headache and sore throat. Often dismissed as a cold or flu, malaria or dysentery. That's stage 1, but there's no ignoring what comes next. Vomiting, bloody diarrhea, a skin rash, and bleeding from the eyes, nose, ears or mouth. Once those symptoms set in, the person is contagious and has 6 to 16 days to either beat the virus or die. The death rate high, 50 to 90%, depending on the strain and access to medical care. If an infected patient with a strong immune system gets to proper care, the chance of living through it goes up. If you survive, you have immunity for at least 10 years. But too often people don't. A heavy burden for aid workers who see their final moments.
And I just don't know what happens if that's repeated 1,000,000 times. And so I say, at all costs, we can't let that happen.
Stopping the spread is now a world priority. Doctors have also worked to find out how it began. It's thought it came from a forest on the Guinean border, possibly starting with the death of a 2-year-old girl just before last Christmas in the village of Meliandou in the country's southeast. The infection has ravaged Guinea and neighbouring countries since. Nigeria and Senegal are now Ebola-free, but they were among the first 2 countries to feel the touch of Ebola, along with Liberia and Sierra Leone. By late March, doctors had diagnosed half a dozen cases across the region. By June, hundreds were infected, dying or dead. The current count, more than 4,500 fatalities. Twice that number are infected. 1 in 20 are thought to be health workers, something these countries already have very little of. Some estimates put the figures for doctors in Liberia, for example, as low as 0.1 per 10,000 people, or around 50 doctors for the country's whole population of more than 4 million. The days are hot, the hours are long, the work is hard and emotional.
And you see some patients, you cannot do anything for them. They are dying, and all you do is you watch them die. Sometimes you pray for them and do the little you do and just hope that something miraculous happens. And you have so many patients in agony. Patients are crying in pain. Some patients are dying unconscious. Some patients need help. Some patients cannot move any longer. We have to take the risk and cater to the patients, or else our country will be wiped away.
Survivors of a disease which has killed so many so quickly know how lucky they are. Nancy Wrightball, a US aid volunteer, contracted the virus in Liberia and was treated in Atlanta with a new drug, ZMapp, which she credits with saving her life.
There have been good days and there have been bad days, and just regaining my stamina and just growing stronger, and I can see evidence of just being able to walk further and just be stronger each day.
Doctors are certainly hopeful that ZMapp could be groundbreaking in stopping the symptoms. But it takes months to develop, and the world's supply has already run out, leaving frontline staff frustrated, some threatening to strike.
We have to be equitable to everybody, and it takes time. Resources are scarce. We're trying to meet all their needs, and we'll continue to do that.
I don't want to strike, but the president has to listen to the mass of health workers out there. They are angry people. You don't want to have angry people knocking at your doors during this kind of emergency situation. So the president has to listen and act very fast.
The need for urgent action is understood in Western Africa. The human cost of this outbreak is staggering here. Thousands of children have been orphaned. Survivors are busy burying family and friends. There are food shortages, widespread quarantines, and everywhere fear. That fear is now spreading just like the disease. It escaped Africa via travellers by air and overseas. The first case in the US arrived via 42-year-old Thomas Duncan, who flew into Texas from Liberia on October 1st. By the 8th, he had died. 2 health workers who treated him, Amber Vinson and Nina Pham, are infected and in hospital. Friends and family have been holding vigils day and night, keen to remind the public at home and worldwide that their loved ones are more than just another statistic.
She is that best friend that you have, and that whole life, your whole life you're trying to live up to be like her, to be that caring and loving and selfless and there for you. She's that person. She's not just another news story, that she's somebody's best friend.
The US is one of several countries now hoping to stop the spread with new security measures and Ebola screenings at the country's main airports. But will they work?
This is an additional layer of screening that can be targeted to that small population in a way that will enhance security, but also minimize disruption to the broader traveling public.
There's a 21-day incubation period. People may not have a fever when they're passing through the airport. And invariably, when a case comes through, people are going to ask, we had this temperature screening set up. Why did this happen? And I'm telling people that it's completely predictable that it will happen, because this is not a foolproof way to prevent Ebola from coming into the country.
It may not be foolproof, but at Heathrow, it's reassuring worried travellers.
We don't realise that how this could implode on the whole community. One nurse is infected, then several patients, and all of a sudden you could have it spreading, right through the communities here. We don't want that, do we?
I do support them, because we obviously need to protect our shores. That doesn't mean we shouldn't have something to do with the rest of the world and helping them recover from the crisis, if you like, but I definitely think it's a good idea.
It's necessary, because look at what happened just now, the other day in the United States, for example. He went to the hospital, they didn't really check him out, and then he ended up dying. So yeah, I think it's necessary.
But there is one disadvantage to all these extra precautions. They could fan the flames of mass hysteria. Authorities now have to battle that too.
We have to keep this in perspective. As our public health experts point out, every year thousands of Americans die from the flu. I've met and hugged some of the doctors and nurses who've treated Ebola patients. I've met with an Ebola patient who recovered right in the Oval Office, and I'm fine.
But fear is hard to fight, and it's spreading fast. Ebola jokes are now the new airport no-no. This was the scene on one flight which landed in the US after a passenger joked that he had the virus.
Right, here's the situation. I need everybody to sit down. Please stay out of their way. Let them do their job.
While just its mention on another jet caused an emergency landing.
We had a conversation, we believe, between the pilots and the tower, and somewhere in that conversation we believe the word Ebola was used, or Ebola-like symptoms.
The US has considered banning people who could have Ebola from boarding public flights. If the virus spreads further, what other steps might the world have to take in the battle against a deadly disease?